Okay, good evening, everyone. First of all, it's wonderful to see such a wonderful gathering here today. And I would like to also thank Norbert Nordes for inviting me for me to carry out my presentation. My topic today is on the soluble intragastric balloon by Alluvien for weight loss. Personally, I feel that this could be a potential game changer in weight loss management. And I feel that it could be a valuable adjunct and could be used as a combination therapy along with bariatric surgery and pharmacological medications for the treatment of obesity and diabetes. Before I go into the details about this balloon, I think it's important to understand the background. How did it come into the market and how it was invented? So basically, this was founded. The Alluvien balloon was founded in 2009 by Dr. Shantanu Gaur, Samuel Levi, and Dr. Ram Chutani and John Wicker got involved in the program in 2010. They basically came across thousands of obese patients who could not lose weight. They tried dieting, they were scared of surgery. So they found frustrated obese patients who wanted something easy and convenient, just like a magic pill. And so this balloon came into the market. The Alluvien balloon has now spread across 58 countries, and they have already treated 90,000 patients. How did we get interested into it? A lot of you must have heard about Dr. Mohit Bhandari. He has started a Alluvien intragastric balloon program in India. Now, Dr. Mohit Bhandari has conducted the most number of bariatric surgeries in India and probably in the world. And he has already treated a lot of patients with this intragastric balloon. And he had presented his data just a couple of months back. He had conducted a Zoom meeting with all the bariatric surgeons in India. And from Parkview, I attended his training session in August. And we have received a certification for using the Alluvien intragastric balloon in Parkview. The good thing about this balloon is that it's the only approved balloon in India. It is covered under insurance. The device is fully licensed and is approved for sale in India. Now, why is this balloon so special? It does not require any surgical procedure. It does not require any general anesthesia. No hospital admission. It can be done in the OPD setting. It takes just about 15 to 20 minutes to do this procedure. And the most important thing is that it does not require any endoscopy. This is my next slide. Actually, balloons were there, before in the treatment of weight loss, and here I have highlighted 5 balloons, but none of them were licensed in India. And the most important thing is that these balloons needed 2 endoscopic procedures: one for putting the balloon in, one for removal of the balloon. The Alluvien balloon basically is put orally and is excreted naturally through the intestine. So how does it work? It is designed to reduce food intake by taking up space in the stomach. It breaks the habit of snacking, trains the patient to eat smaller portions. Patients lose an average of about 10 to 15% of body weight in the first 16 weeks, and they develop a new understanding of their body and help them to kickstart new lifestyle preferences. So I have a video. It's a 2.5 minutes video. The video, I'll just give you a bit of description about this balloon. So this is the balloon. It is made of a very thin film, thinner than the silicone balloons. And this balloon is enrolled or is enrolled into this capsule, which is connected to a catheter. So the patient swallows the capsule. It goes into the stomach. The capsule dissolves. Takes about 4 minutes for the capsule to dissolve. The balloon is inflated, and once the balloon is inflated, the catheter is removed and the valve is shut here. So this is a release valve. So what happens after 16 to 18 weeks is that this release valve, they have a filament which is made of a very thin suture. That filament gets dissolved, and the water is basically comes out of this balloon, and the balloon is finally excreted through the intestine. So I'm just going to show you a video.
Okay, so now's the time to swallow the balloon. Okay, so you've got to remember that this is no bigger than a piece of food that you would normally eat. So some of the worries are psychological as much as anything. Here's the balloon. Okay, so this is in a casing that will go into your stomach, start to melt, and then we can fill it up with this tubing here. Alright? That's it. Head nice and far back. Maybe just do a dry swallow now. That's it. And head forward and hand away. And big gulps. Really big gulps. Now, really big gulp now. We're almost there. Okay, so one more gulp and we're done. What a superstar. Well done. And if we stand up, we'll take an x-ray. On the x-ray, and the balloon is in the perfect position. So now we're going to connect it to this bag of fluid. So here, you've got a bag of fluid, which is 550 mils, which is a pint, essentially. And then this is a pressure bag. So people worry that this whole thing is all water. It's not. This is all pressure bag, and this is the water. Okay? So I'm just going to connect up the ends. So keep holding where you are. Just going to connect that up. Start that flowing. So you should feel cold water running down. Yeah. So I'm just going to pump this up now, so that we've got a bit of pressure on it. And then you've got about 3 or 4 minutes just to sit there nice and relaxed while it fills up, okay? So that little pill that you swallowed is transitioning into this grapefruit-sized balloon. This thing here is the release valve. So at 4 months, this will disintegrate, and then the balloon will just empty, and then you'll pass the casing. So you might not even notice you pass it. Dripping. And that's the last little bit there, so we just shut that off. You're all done. Okay, and if you stand up for your second x-ray. Okay, so Georgie, we've confirmed that the balloon is in a great position in your stomach. So now it's time to get that tubing out. Just look forward, and then what I'm going to do is just pull on this tube. So open your mouth. Now in a minute your head's going to recoil back as it snaps off, okay, so just be prepared for that. Any second now it's going to snap off, okay? There you go. And it's all out, it's all done. This is your set of scales, digital body fat composition scales, and the watch, which is a health tracker. And all of these act via the app on your phone, and you can share the information with our dietitian. Okay, so now's the time. Okay, so now's the time.
Right, okay. Now, this balloon can be used in a lot of obese patients, but there are certain indications, certain guidelines have been prepared. Body mass index greater than 30 to induce weight loss or to treat obesity-related conditions. Patients who qualify for bariatric surgery, high BMI, 45 to 50, but surgery and anesthesia are at a risk. It can be a bridging therapy prior to undergoing bariatric surgery by decreasing anesthetic-related risk and reducing hepatomegaly. What are the contraindications? Previous gastric surgery, coagulation disorder, bleeding, lesions in the upper GI tract, pregnancy, large hiatus hernia greater than 5 centimeter, severe liver disease, alcoholism. Now there is a regime or a protocol which has been put into place before the balloon is inserted. So the day before the placement, the patient has to be well hydrated. They need to drink plenty of fluids. They need to take medication as prescribed. They can have a light dinner the day before its placement. On the day of the placement, they consume only clear liquids 8 hours prior to placement, and they are supposed to stop all clear liquids 2 hours prior to placement. There's a fixed medication schedule. Before 2 weeks prior to the placement, they are supposed to be on an oral PPI. They're giving an anxiolytic before the procedure. On the day of the placement, they're giving an antiemetic, which continues for about 2 to 3 days. They are also given an antispasmodic. Post placement, they are kept on PPI for about 2 to 4 weeks. What are the symptoms post procedure? Generally, many patients have no symptoms at all. The common symptoms are nausea, vomiting, abdominal pain, abdominal cramps, esophageal reflux. But they are generally mild and they tend to resolve in due course. Results. As for my previous slide, the weight loss is around 10 to 15%, and there was a huge study carried out where data was collected from 1,770 patients. Ellipse was the old name, now they use the word Allurion. BMI study was between 34 and 40. The conclusion was that it exhibited remarkable efficacy with a body weight loss of around 40.2% and improvement across all metabolic parameters. There was another study which compared the efficacy of various intragastric balloons. Again, it demonstrated a weight loss of around 12.8% at 4 to 6 months and 11% at 1 year. What were the complications and adverse events? It's very less actually, almost less than 0.5%. And most of the adverse events happened during the initial placement of the balloon. Here you can see 3 cases of small bowel obstruction, one case of gastric perforation. This happened because they were placed in patients who had already had previous gastric surgeries, laparotomies and all. At that time, the guidelines weren't that strict. So which patients are suitable for this procedure? Patients with existing medical conditions, those who don't want to have bariatric surgery, they just want to prolong the surgery. Before marriage, patients who are going to get married within 6 months, they have benefited with this balloon. They've got a quick weight loss of around 10 to 15 kilos. Patient with low self-esteem and who wants the procedure to be done in a confidential way. Patient who are scared of surgery and endoscopic procedures. And in other specialties, orthopedic surgeons, they want patients to lose weight before carrying out knee replacement and spine surgery. In obstructive sleep apnea patients, where they are advised to lose 10 to 15 kilos before they can do any intervention. And in PCOD clinics. In conclusion, I would say that the ease of use, low rate of adverse events enables much wider application of the gastric balloon technology. Elimination of endoscopy and sedation may expand its use to a wider group of physicians and other specialties. It's a valuable adjunct and should be used as a combination therapy with bariatric surgery and medications. However, we should remember that the Allurion gastric balloon is not a magic pill. The patients have to be counseled about weight loss expectations. And we all should remember that Dr. Dey was telling that obesity is a chronic disease. We are not simply curing them, but we're giving them a disease-free period. And a combination therapy of surgery, medical management, and balloon is the future for long-term obesity management. And the Allurion intragastric balloon is just another wonderful addition to solving this issue. Thank you. I think in Pagi we will be starting an integrated obesity clinic at some point, so we'll let you know about this.
The cost of it?
The cost is around, at the moment, it's around 2.5 to 2.7 lakhs. But it should come down because it is becoming very popular. It should come down in the near future.